Most people that I talk to don't really understand what home care is. I mean, everybody knows that we have an aging population. Everybody knows that there's a need for care for seniors. But when people are looking for a business, et cetera, they know that there's a demand for senior services and a need for senior services, but they don't know about home care. A lot of people think that home care is facility based care, like assisted living, or they think that home care is nursing care, or they just automatically assume that home care is something that when you need it, your Medicare pays for it. So people have real misconceptions as to what home care is, the value that it can bring to allow older adults to stay at home, which is generally where they want to be. A lot of people too, when they're thinking about starting a business, they want to start a business that means something to them, a business that, where they feel like if you're looking at a business where you want a business where you feel like you're helping others, where you feel like you're serving others. Sometimes it's difficult to find a franchise concept that sort of fits that mold. And home care really does. So that's something that initially attracts a lot of people to thinking about home care as a business, is just a desire to do good, a desire to help others. And this is one of those, few or rare franchise concepts that allow people to do that. I'm Kurt Buskey, president of Better Solution In-Home Care, and today we're talking about what home care is and how do people pay for this type of service. Well, home care, in its simplest definition, is really assisted living at home. We've all seen assisted living facilities. Some of them look like country clubs, etc. And there's caregivers in those facilities available to help the residents. And really, home care is assisted living at home. We have the same type of staff, caregivers, but we're able to provide one-on-one care to people in the home environment. And it's also a scalable model of care, meaning when you live in a facility, if you don't need care all the time, you're still living in a facility where care is available to you all the time. Whereas home care is scalable. So we're able to meet people where they're at, provide the type of assistance that they need at this point in time. And as their needs increase, if they increase, we're able to scale care to continue to meet their needs. And really, the idea here is that home care is designed to prevent or at least delay institutionalization in residential care environments. So home care is really what we call non-skilled or non-medical care. If you think of, home health typically refers to skilled agencies where a physical therapist or a nurse may come out to the home, may be paid for on a short-term basis under a physician's orders, paid for under Medicare. Whereas home care is different. Home care is really non-medical assistance, the type of care that someone would receive in an assisted living facility, a caregiver helping a senior get through their day. And so really what that means, we talk about activities of daily living, but a lot of people don't understand what activities of daily living are. It's really generally helping people get out of bed, bathing people, grooming people, even handling things like incontinence care, really just helping people get through their day as they're unable to accomplish all of their activities of daily living independently. Other things that home care can help with are very important for individuals that are losing their ability to take care of their environment. So we can do light housekeeping, as well as individuals who are having trouble preparing nutritious meals. We can also do meal preparation as well. So we call those homemaker services. And also it's very important to note that sometimes somebody may not need a lot of assistance with personal care, but maybe somebody has a cognitive impairing condition like Alzheimer's disease. And so they need a companion caregiver because they're simply unsafe alone. And so that's something else that home care can help with. In terms of what home care is not skilled care like physical therapy. It's not nursing care, wound care, medication management. These are skilled types of services that would need to be provided by nurses, physical therapists, etc. The scope of practice of a caregiver is really just helping somebody get through their day, assistance with activities of daily living. Everyone wants to know how home care is paid for. And, this can vary by area. Traditionally, home care has really been a private pay type of situation. really the same payer mix as an assisted living facility. Assisted living facilities are generally private pay and long-term care insurance. So home care has traditionally been the same as assisted living. So private pay, sometimes families get together and chip in to care for a loved one. Sometimes they utilize savings, etc. Long-term care insurance can also pay for home care. Medicaid can pay for home care, but if you're looking for a home care organization that will accept your Medicaid coverage, then you have to make sure, obviously, that that organization is Medicaid certified. VA benefits, Veterans Administration benefits, can also pay for home care. Same situation, you need to make sure that your provider is credentialed with the VA. There are some alternative payer sources for home care as well in some markets, but this really does vary by market. Medicare Advantage plans or private Medicare plans, some of them will allow payment of non-medical home care services. There also are some local nonprofit organizations that provide funding and support, whether it be for respite to give a family caregiver a break from caring for their loved one through a professional home care organization, or direct funding and grants for home care services. There may also be some programs through local area agencies on aging related to home care services. So there's a variety of options. They do tend to vary by local market, but certainly private pay, long-term care insurance, VA, and Medicaid, fairly consistently can pay for or reimburse for home care services across the country. Well, if you'd like to learn more about starting a home care business, a business that really puts you in a position where you can serve your community, be a part of the fabric of health and aging services in your community, and be of service to others, please feel free to reach out to us anytime. We can be reached through our website, which is www.absihc.com. We also have a franchise website that has a lot more specific franchise information at homecarefranchisepartners.com. You can also reach us via phone anytime, 877-585-9011.